Hi guys, this is Peyton again. Now I am going to show you how to insert an IV and to get an IV started. This is my patient. He's not very cooperative because his head won't stay up, and my dog is actually mad at me right now because it's his toy and he wants it back, but he's gonna have to wait. Okay, so before we get started, we want to make sure that the patient's arm is in a dependent position. That way gravity helps fill the vein. You can also place like a towel or something underneath the patient's arm just in case there would be any leakage of blood or anything like that. That way you can save the linens. After we place the arm in a dependent position, you can go ahead and apply the tourniquet. I guess I can go ahead and take the tourniquet out and attempt to do this with this stuffed animal. Okay. When you apply the tourniquet, you want to apply it about 4 to 8 inches above where you're going to stick the patient. This is hilarious. Okay. So once we get that tourniquet on there, you want to be able to palpate the radial vein. If you cannot do that, you need to loosen up the tourniquet a little bit because it's too tight. Once the tourniquet's applied correctly, you want to select a vein that is distal. So you want to select a vein that is closer to the hand or the lower arm. When you're selecting a vein and you find one that you like, you want to push down on it, make sure that it rebounds quickly. That way, you know that's a good vein. It's not going to roll on you or anything like that. If you're having trouble with that, you can have the patient make a fist, or you can actually apply heat or anything like that, warm compresses, to help the vein kind of come out. Once you find a vein that you like, we're going to go ahead and undo the tourniquet. It's harder to do it on a stuffed animal. So once you undo the tourniquet, I'm going to go ahead and do that. That way, while you're getting the things ready that you need, you can promote comfort for the patient. So I already have my stuff out here. And I have selected the appropriate size needle that we're going to use. So I'm going to go ahead, once I have everything ready, I'm going to go ahead and apply the tourniquet again. Okay, have that applied. I can palpate my vein that I want. And before I have done all of this, like once I'm getting ready to open the package, you're going to don non-sterile gloves. And then when you do open the package, you're going to only touch the outside. That way you keep everything kind of sterile on the inside. Okay, so once I have that, I'm going to take out the cleaner. I'm going to go ahead and snap it. Then we're going to cleanse the site. After we cleanse it, we want to wait about 30 seconds and make sure it dries. You want to let it air dry and don't fan it. Okay, so once I have cleaned the site, I'm going to get my needle ready. Okay, and when you get the needle ready, you want to inspect the tip and make sure there is no burrs or anything abnormal with the tip. When you insert the catheter, you want to insert it with the bevel up. Okay, so when we're getting ready to insert the needle, you want to kind of pull downward on that vein. And you want to make sure you're not in the sterile, where you sterilize. So downward on that vein to kind of pull it taut. And make sure the bevel is up, and then you're going to inform the patient that you're about to stick them, that you're going to feel some discomfort during this process. And once you insert, when you get ready to insert the needle, you want to insert it quickly at a 30 to 45 degree angle. So I inserted my needle, and once you get that flashback of blood, you're going to release the tourniquet. And this one does not want to come off of him. Okay, once you have inserted the needle and you get that flashback of blood, you're going to level it to about like skin level, and you're going to insert it a little bit more, and then you're going to release the needle so that only the catheter is left in the patient's arm. And once you release the needle, you're going to hold with one of your fingers, hold the catheter in place while you get a dressing ready and everything like that, and then you're going to dress the IV site once you get finished. I think that's it. Thank you for watching.